guys, this is Dr. Megan Magner from Spine Rehab in Mclean, Virginia. Today I'm with my lovely assistant Andre, and we're going to talk about ankle sprains. So just to clarify what an ankle sprain is, you have soft tissue that connects bone to bone, and that's called a ligament. So anytime you have a sprain, basically that ligament is stretched a little bit to the point of breaking, and how much it breaks depends on how severe the sprain is. So it goes from grade 1, 2, and 3. Grade 1 is kind of like a simple just twist of the ankle, whereas grade 3 is a gross tearing of that ligament. So the important reason why you want to get that ankle rehabbed is when that ligament is lengthened, that creates instability. It's that overall instability that creates that repeated ankle sprain over and over and over again. Here at Spine Rehab, what we do is we help the ligament heal a little bit better. Also, we help strengthen the muscles that typically become weak in ankle sprain type situations. The muscles on the outside of the ankle, the ones here at the top. So basically with Andre, I want to show him and yourself some ways that we go ahead and treat that ankle. So what happens when you have that instability there, sometimes the muscles will spasm around the ankle. That can create a change in how those joints move. That can create inflammation. So to help basically adjust the ankle to make sure those bones are moving correctly, what we're going to do is adjust, okay? So I'm going to show here how we adjust Andre's talus right here. It's this bone, basically the rest of that shin sits on. So what I'm going to do, okay, I'm going to grab the ankle like this and I'm going to pull towards me, just like that. Okay, good. I'm also going to adjust his heel, the calcaneus. So what I'm going to do in that, okay, I'm going to come across, you'll feel a little pushing and pulling. Good, just like that, okay? And there's some other bones that we can adjust too, but I won't go into detail about that. One of the other videos that we've done is about Graston. So we also typically Graston sprained ankles, and the reason for that is the same way. We want those ligaments to heal the best we possibly can, and we want to limit the amount of scar tissue that happens around the injury site. Okay, so this is some of the common areas that we would Graston in ankle sprains. Good. All right. Just like that. Excellent.